Hello, I'm Dr. Wickham Simons from Dr. Simons Metabolics and Weight Loss, and I'm answering common questions about GLP-1s. I get these questions every day in the office, so I'm doing a little series of videos to kind of post these on our social sites and on our website so that people can look and easily access this information. One of the common questions I get is about how do you administer the medication and how often, and are there oral versions? And so the answer to all that is that the medications currently that are approved for weight loss, which are for the treatment of obesity, which are Wegovy and Zepbound, these are once weekly injectables that come in auto-injector pens so that the pen has a certain dose in there, and it's a very tiny needle that you don't see, and you press it against your belly. You press it against your belly fat, or on the thigh, for example, anywhere where there's some subcutaneous fat, and it will auto-inject itself if you follow the instructions. And I just tell you, if you feel anything, it's not much. Most cases, the patients can't really even tell that they've done it to themselves. I mean, they hear the little auto-injector, but they don't feel the sensation of pain. So that's how they're supplied, and it's just once a week. It's not something you do every day. Now, I've explained on previous videos that some of my patients do a compounded version of that because they're unable to afford the brand name stuff, and there's no insurance coverage, and we're able to get it from you from reputable compounders, the compounded form. And this comes in vials that you have to draw out with insulin needles and syringes. It's still a once a week injection, and we teach you how to do it. And it's with a little insulin needle and syringe, which is tiny, but in my opinion, little, if any, pain at all. And you give it anywhere there's some tummy fat or subcutaneous fat, like on your tummy or on your thigh, for example. And it's just once a week, just like the name brand stuff. And you would have someone here from the office go over the dosing with you. One of us will go over the dosing with you, how to draw it up, how to administer it, all of that. There is not yet an oral form approved for obesity. The oral form for the treatment of diabetes is called Rybelsus, but there is an oral form coming for the treatment of obesity. And Novo Nordisk, who makes Wegovy, is coming out with that. I've heard that the oral form may also be called Wegovy. We'll see. I expect that will get approval by the end of this year. This is now 2024, and then be on the market some point thereafter. I don't know anything yet about pricing or insurance coverage, but it is coming. And so for those of you who want to do an oral form rather than an injectable form, I think something is coming down the pipe and should be available within a year or so.